session 4, the birth. So you're in active labour, you've been invited in, you're in one of the rooms on the labour ward or the birth centre, and you are there with the midwife that's looking after you and your birth support person. You've got the room dimly lit, you've maybe got your little LED candles, switched on. You've got the music of your choice playing. You've got a little maybe the pillow, or at least a pillowcase that you've brought in from home that smells familiar. All the things that we talked about previously about creating that good ambience to make you feel more calm, more relaxed. Yeah. So the midwife that's looking after you is going to be really just observing the natural process of labour, because it is just a natural process that we're observing here. But when you first arrive, of course, she's going to be doing all the initial checks on you that you would have if you were seeing your community midwife for an antenatal appointment. Checking your weed and your blood pressure, listening to the baby, all those sorts of things. But as well as that, she's also, in that initial sort of assessment with you, going to be offering you a vaginal examination just to see where you are in your pathway of labour. It's an offer, you don't have to have it, but most women are very happy to be examined at this point, so that both you and we can have a sort of an idea where we're starting from, where you are in your pathway of labour. Internal examinations are not, so vaginal examinations, internal examinations are not, something that's done really regularly, lots and lots and lots of them. It's, on average, it's usually about every 4 hours or so. So you may have one more, maybe two more, maybe none more in your process of labour with us. So, along with all of that that first assessment, once that's all done, then it's just waiting and letting the labour unfold. So we're going to be talking about in subsequent videos the sort of pain relief that you might use at home, and then pain relief and coping strategies that you might use in the hospital. You might not need any of them. You might be just chilled and relaxed and doing your own thing. But we'll talk about the things that are offered in a subsequent video. But we'll just think about this, we're watching this natural process occur. The labour is unfolding using whatever you need, but the labour is unfolding. And during that passage of time, in the active part of labour, when you're with us in the first stage of labour, so while the neck of the womb is opening around the baby's head, the midwife that's caring for you will be obviously helping you, supporting you as much as she possibly can through that journey. But she's also going to be listening in to the baby about every 15 minutes in that first stage of labour. Just with the little Dopplers, like we do when we care for you out in the community, just for a snapshot in time, just to make sure that all is well. And just keeping a bit of an eye on you really as that process unfolds. As the neck of the womb opens around the baby's head, as you get nearer to going into that second stage of labour, there's a space in time between when the neck of the womb almost is open completely around the baby's head and when you get that feeling that you want to start pushing. It's called the transitional phase, and during this time there's a lot of hormonal changes, and sometimes during this time girls that have been lovely and calm and relaxed can suddenly not be so relaxed. Like, I want to go home now, I've had enough. Yeah, this is really normal, really. It's a really short space in time. It's a really normal sort of rush of feelings that you get. Now, there's a really good breathing technique that I want to teach you for this, but I'll show it to you when we're doing the active birth video, because I need to ask my husband to give me a little hand to be my partner, so I can demonstrate some of those things with you. So I'll persuade him to come in from the other room and join us to demonstrate that in a little while. But meanwhile, so that's a breathing technique that we'll talk about in a while. But meanwhile, let's think of this birthing phase. So the neck of the womb has slipped back over the baby's head, and it's almost time. You might be starting to get those sensations that it's almost time to start to push your baby out. And the kind of sensations that you get, the kind of feeling that you get, is often a feeling that you want to have a poo. Now, when girls are going into the second stage of labour, when they're almost ready to start to push, sometimes we don't need to examine them to confirm that the neck of the womb has slipped back over the baby's head. There's plenty of external signs that will show us, and one of those external signs is the way that you change with those contractions, those waves, those surges. So the breathing that you were doing before and the way that you were with them becomes different. With the surges, with the contractions, you become much more now, a little bit, sorry ladies, a little bit like a mooing cow. That's the feeling that you get. It's almost like you're really holding back this feeling to have a poo, yeah? That's the really natural sensation that you'll feel. Now, when you see girls on, you know, when you see TV programs, TV shows of people birthing babies, you often don't see people doing this. What you see in exchange is people going, ah, ah, yeah? It's exactly the same feeling, but for them, where fear has taken over, they're just using this part of their body. Ah! Whereas I want you, now you've, you know, had maybe not the whole antenatal classes, but just a little bit of a taste of things, that you begin to realise that actually this is a really normal sensation, and go with it. That's the feeling. Just let it go through the whole of your body. Now, in hypnobirthing, we like to call this sort of breathing, we call it J breathing, down breathing, or hypno-pooing. Yeah, that's right, hypno-pooing. Yeah, and the reason that we call it that is because it's the only chance that you have during pregnancy to actually practice this kind of breathing. Yeah, so you can practice it when you're on the toilet having a poo, and actually it's absolutely revolutionary for all of us, whether you're pregnant or not pregnant. Those folk that suffer constipation, it's a really useful tool. It's called down breathing, J breathing, or hypno-pooing. And what you have to imagine is that you've like got a rod in your back, so you're pushing down through that straight rod with a little flick at the end. So there's the letter J. So that's as it goes round. It's almost like, so if I get my pelvis out again, it's almost, you know, that there's that J shape. So so that's easiest achieved when you're in a good upright position, which of course we'll come to when we're doing our active birth stuff. Being nice and upright makes it easier to do the so a little J, a little, imagine a rod in your back with a little flick at the end. And it's also not about holding your breath and going purple in the face. Often, you know, when you see births from years gone by, when you see them televised, when you see them in plays, when you see them in shows, when you see them, you know, in older documentaries, what you see is people often being told to hold their breath, put their chin on their chest and push down into their bottom. We now know that if you do that, what happens, of course, is you're not only restricting the oxygen, so apart from going purple in the face, you're actually reducing the oxygen supply to yourself, and of course in turn to your baby. And also, if you think of your pelvic floor like lots of elastic bands all strung together in different directions, if you give a big push, like holding your breath, going purple in the face, not only are you giving yourself less oxygen, but you're giving a big push down into that very stretchy pelvic floor there. And if you do that, it's like putting some really, really heavy on a trampoline. It stretches it and it doesn't go back to its initial tension. Whereas lots of lovely nudgy pushes, so that it's like nudging the baby down through the birth canal. And that is also a really good way when we're thinking of sitting on the toilet with constipation as well. I'll discuss no more of that, but just to make you sort of think about, that's the different breathing. So from the, we've now become, with that urge, with that sensation when the neck of the womb slip back over the baby's head, and that feeling that we get that makes us want to have a poo, use it in a really good, effective way. So I've already shown you my pelvis earlier on, and I said the more space when you weren't sitting on it and all that we talked about in a previous video. But here what we're thinking about now is the baby coming down through the birth canal and out into the world. So we already mentioned that the babies come down through the birth canal like this, and they rotate into this position to come out into the world. So if you can see my face, you can see the back of the baby's head. If I'm on all fours and you can see my bottom, you can see the baby's face. So that's the way that they're coming. Now, when you start to get that feeling to push your baby down through the birth canal and out into the world, the baby is not going to appear straight away. With the first push or so, the baby does not appear. It could be, I'll hold the baby this way, you see better on the screen. It's a bit awkward to do it that way, so I have to do it this way. When you start to push, the baby's head is not going to appear straight away. But what is going to happen is that the baby is gradually just calming down a little bit, stretching its pathway, stretching its pathway. It could be about an hour of those good, nudges down through that birth canal before you start to just see the very, very, very top of your baby's head. And when the top of that baby's head appears at that vaginal area there, at the end of that contraction, that wave, that surge, in the beginning, the baby's head will slip back. That's not bad, that's normal, that's supposed to happen. With the next contraction, wave or surge, then that baby will come back down again, and maybe just a little bit more of the baby's head will start to show. And then it slips back again, and with the next one, a bit more comes up. And with the next one, a bit more comes up. And with the next one, a bit more comes up, until you get to the point where it's not slipping back anymore. That's really good news. That means, that we're on the home straight now. That means that it's that with each of those contractions, each of those waves, each of those surges, little bit more, little bit more, little bit more, little bit more of that baby's head is going to appear, until very soon what we'll start to see is lots of the baby's head, and we'll get to the point where the largest part of the baby's head is just sitting there. That's really good news, because that means with the very next contraction, wave or surge, hopefully the baby's head then is going to be born. Now, if I turn this around, you can see the baby's head. It's really awkward because I'm right-handed, so it's really awkward to hold the baby this way, but I'll do it so you can see it on the screen there. So the baby's head is now out, and what you are going to see, hold on a moment. Let's do this properly. So yeah, there you go. The baby's head is now out. So if you could see my face, you're going to see the back of the baby's head. Yeah. So that's that. The baby's head is now out. So between the contraction that births the head and the next contraction, wave or surge, that's going to birth the rest of the body, what's now going to happen is there's something that's always fascinated me, always amazed me, I've always loved throughout the whole of my midwifery lifetime, and that's something that happens between the head being born and the rest of the body born. And what it looks like happens is it looks like the baby's head does a quarter turn. Not in a scary movie sort of a way. It just looks like the baby's head does a quarter turn, a bit like this. Sometimes they have their little eyes open, sometimes they blow a few bubbles, yeah? But of course, that isn't really what's happening. Of course, what's really happening is it's not just the baby's head rotating, the whole body is rotating, because of course the baby can't fit through the birth canal, through the pelvis, this way round. So what has to happen is the whole body has to rotate, so that with the very next contraction, wave or surge, then one shoulder is released, and then the other shoulder can be released, and the baby will be born up onto your tummy. Yeah, the baby does that. I made that look very awkward because of holding it in the air to show the film and everything, but actually in reality the baby does that itself, and it's a really amazing process to see. As I say, it looks like it's just the head that does the rotation, but actually it's the whole body, but you just can't see it because it's underneath the pelvis. So that baby rotates, so one shoulder, the other shoulder can be born, and the baby then can be born directly up onto your tummy. Unless you tell us otherwise, we'll always put the baby directly up onto your tummy. It's so amazing to do. When the babies are up onto your tummies, not only do you get a really good look at what you've just produced, yeah, which is amazing. But also, when the babies are against you, they've been luxuriating in 37 degrees for a long time. Now coming out into the world, and the room temperature is usually about 22, 23 degrees, which for us feels lovely and warm, but for them it's a little bit cold after being luxuriating at 37 degrees. So to be against you, your body helps to regulate the baby's body temperature. Also, of course, when the baby is against you, it hears your heart beating, and when it hears your heart beating, that is really comforting and reassuring for the baby, because it's been a noisy old world inside of you. So when it hears your heart beating, that tends to regulate its heart, so it's much calmer and much more relaxed. And of course, that also means that if it's not so anxious, that your baby isn't burning up so many, so many calories, so it keeps its sugar levels more stable as well. As well, of course, of that baby smelling you, of course, is key to helping to initiate that feeding as well. So against you, unless you tell us otherwise, is what we'll always do. Yeah, so you have a really good look. And of course, the one thing we're going to look at pain relief and coping skills and all the rest of it, think about birth preferences pages in one of the other videos. But what I would say to you is, if you don't know whether you're having a boy or a girl, and quite a lot of people do wait for that surprise on the day these days, so if that's you, then it's worth putting on your birth preferences page. Don't tell us if it's a boy or a girl. We want to have a look on the day. So that's, of course, when you've got your baby in your arms, something else that you're dying to have just a little look at and see what you've got there. So we're going to stop this video here and see you in a while.